My name is Martha Santana Chin, CEO of LA Care Health Plan. Leading the nation's largest public plan isn't just my job, it's personal. I know firsthand the security that Medi-Cal provides because I grew up on Medi-Cal. As the eldest of 9 children and daughter of immigrants, my family struggled financially. But because we were able to rely on Medi-Cal, I never had to worry about being able to see a doctor. That's why now I cannot stay silent as cuts to Medi-Cal are being considered. In Washington, there are proposed cuts to Medicaid, known as Medi-Cal in California. The cuts being discussed will result in federal funding flowing away from our state. These funds directly support our children, working families, seniors, and people with disabilities. These discussions are still unfolding at the federal level and will require congressional action. It's important to note that no changes to Medi-Cal eligibility or benefits have been made at this time. All eligible LA Care members have access to their health benefits and services, so everything remains the same. However, that may change. We expect to have a better understanding of the changes that may happen by later this summer. If the cuts being discussed are approved, it will further strain California's Medi-Cal budget. If this happens, California will be forced to dramatically reduce coverage, benefits, and funding for health services. And let me dispel a myth for you. This wouldn't affect just some people. Any Medicaid cuts that occur have the potential to impact all 15 million Californians that depend on Medi-Cal. That includes seniors, people with disabilities, full-time and part-time workers, families and children. Let me be absolutely clear about what's on the table. Slashing federal matching dollars for Medicaid would leave the states on the hook to pay for more of the healthcare services, and California is already in budget trouble. Imposing work requirements will result in fewer people being eligible for Medi-Cal and create barriers to healthcare for those who do remain eligible. And reducing or eliminating provider taxes, which are used in 49 states, will result in access to critical services being eliminated. These taxes aren't fraud, waste, and abuse. They are used and have been used for decades by red and blue states alike to secure matching federal funding for their Medicaid programs. And simply put, these federal taxes are approved by the federal government and fund a portion of the healthcare services, much like property taxes fund schools and education. I see fear in communities. Parents tell me they're anxious about their children losing coverage. I hear from seniors who are terrified that they won't be able to afford life-saving medications they depend on. There are more than 3 million working Californians, including retail workers, restaurant staff, and agricultural workers who depend on Medi-Cal while keeping our economy running. This isn't about politics. It's about people's lives. When 41% of Los Angeles counties relies on Medi-Cal, the cuts don't just hurt them, they hurt us, our families, neighbors, abuelitas, tios, kids, our communities. I want you to know that LA Care is actively engaged with elected leaders, providing important education on the negative impact of the Medi-Cal cuts. And we're strongly advocating to protect Medi-Cal's stability, coverage, and benefits. For the millions of Californians who depend on Medi-Cal, their health, and frankly, the backbone of our healthcare system hangs in the balance. Rest assured, we remain committed to our members and will continue to fight for the services and coverage you need and deserve.